Hey, good day, everyone. Justin Gomez with Wake Forest Baptist Health here. We have a special guest today joining us for our inaugural Best Health webinar, Miss Sandy Tysinger. And she is one of our nurse managers here at Wake Forest Baptist Health. So welcome, Sandy.
Thank you. Thank you for asking me.
Thank you for being our first guest.
I'm honored.
This will go down in the annals of history of Wake Forest Baptist Health and Best Health.
Thank you.
So this is just a new program that we wanted to bring to all of our Best Health engaged people out there and subscribers, just as another avenue to really help get the word out about some of the wellness messages that we're talking about at Wake Forest Baptist Health.
Great.
So specifically, Sandy works in the cardiology and cardiovascular department here at Wake Forest Baptist Health. And we have really good information about some heart health tips, staying heart healthy, or if someone maybe does have heart issues, what we can do to help them out. But before we get into that, I want you to tell us about yourself.
Okay.
Why in the world did you become a nurse, and why do you like cardiology?
Okay. So I became a nurse from an experience with my family. I watched my grandfather suffer a heart attack.
Oh, wow.
And unfortunately, he did not survive. And so I always wanted to be a nurse. Life kind of got in the way. So it took me a while to obtain my degree, but I just kept plugging along. And I am a huge proponent of cardiovascular because I lost both my mom and dad to cardiovascular disease.
Wow.
So I constantly preach cardiac health and things that we can do to stay healthy.
Great. Well, thank you for sharing your personal story. I think that's a really special story for why you are so invested in people's heart health.
Absolutely.
I think that's great. So you have been with Wake Forest Baptist Health. Tell me how long?
June 1 will be 39 years.
Wow, 39
years.
So you have a pretty good idea of what the heart looks like at this point.
Pretty much.
What it's supposed to look like.
What it's supposed to look like.
What it does look like sometimes when it needs a little help.
Absolutely.
So as we kind of get into talking about heart health, just tell me a little bit about what you do on a day-to-day basis, and then we'll talk about some of the heart healthy tips that we have for people.
Sure. So on a day-to-day basis, I have the privilege of working with staff who take care of our patients who are in the hospital for congestive heart failure or a heart transplant or open heart surgery, or they're receiving a device to help them either be a bridge to heart transplant, or it's destination therapy, or they've had a heart attack, or their hearts are at a rhythm, or they need a cardiac cath. There is a multitude of reasons. So I do get to work with our patients, but I mostly get to work with our staff who get to work with our patients.
So one of the things, I think this is a good segue, I'm sure what you talk a lot about with your patients, the first topic we want to talk about, and my doctor's mentioned this to me a time or two when I've been to my primary care physician, is proper diet. So we hear that really ad nauseum, right? So you're supposed to eat right, you're supposed to eat healthy. So we hear it, but it's almost like we hear it so much that it's almost white noise, like, oh yeah, I'm supposed to eat healthy and eat that salad, but I'm busy, so I'm going to eat that double cheeseburger instead.
Right.
So if you could just talk a little bit about how you all talk about proper diet specifically with cardiology patients, and how big an impact that can have on someone's heart health.
Sure. So diet is always our number one subject, and it's always a touchy subject for everybody. But eating a healthy diet does not mean you have to give up all your foods you love.
Sure.
It means that we have to watch what we eat and eat it in moderation. So if you eat, for example, country ham every day for breakfast, we know it has lots of sodium and it's really not that good for you. But I'm not saying don't ever eat it. I'm saying eat it in moderation. Yes. So instead of eating that huge slice, eat a 50-cent piece size of ham.
Okay.
And maybe only once a week or once every other week. So you aren't going to be able to eat it every day, but you can eat it some. And eating lots of fruits and vegetables, whole grains, cut down on your sodium. So you should really only have what we say 2,000 milligrams, which sounds like a lot, but 2,000 milligrams of sodium is 2 teaspoons of sodium in 24 hours.
Oh, wow.
So it's not that much.
And I've noticed the sodium can be sneaky.
Yes.
Like if you don't pay attention to the labels, I mean, some foods have a good amount of sodium in them that you wouldn't necessarily think right off the bat.
Correct. You're absolutely right. And we also ask you to low sugar. But our advertisers are very slick, and they'll tell you that there's sea salt, and people think it's healthy, but salt is salt. Sodium is sodium.
Sodium is sodium.
Yeah, it doesn't matter. It all eventually comes from the same place. So it is not good for you because it holds fluid in your body. It does what we call retain fluid. And so it makes your heart work harder if you have to hold on to fluid in your body.
Gotcha. So what is usually followed up oftentimes with the diet conversation, once again, may or may not have had this conversation with my doctor, is exercise, right?
Correct.
So diet and exercise. And we hear this kind of all the time too. And it becomes a little bit of a, I need to go to the gym, or I should go to the gym, but I'm busy. Oh, I'll go tomorrow, or I'll go this weekend. But you really try and hit it home with your patients in the cardiology and cardiovascular, because they're dealing with potentially, some pretty serious issues. So
Correct.
if you could just talk to us about kind of what you talk about with them and how you develop a program
Sure.
with our patients at Wake Forest Baptist Health.
Sure. So the gym is good, but if you can't afford a gym membership or don't have one, there's lots of other ways. Walking is the very best exercise you can do. And I don't mean that Sunday stroll, a brisk walk for 30 minutes a day. That's what you have to do. If you exercise 30 minutes a day, you add 2 hours onto your life each time you do that. So just, so 30 minutes. And then for women, we really need a little weight resistance. So swimming, and you can lift weights if you, go to a gym. But if you can walk 30 minutes a day at a minimum of 3 times a week, you've increased your cardiovascular resistance. So you've, increased your respiratory rate. You've increased your heart rate. You've increased the flow of blood through your body. And all of that is heart healthy. So your heart's a muscle, and it helps build your muscle.
So that's a great point. I guess oftentimes we don't think of it quite like that, or we might not because we can't see it, as opposed to us going to the gym and being able to see the muscle group we're working on, if it's biceps, triceps, whatever. But the heart is a very important muscle.
It is
so
a very important muscle.
you need to strengthen it up like you would other muscle groups, right?
Exactly. And so when you walk and you breathe faster and a little heavier, you increase your oxygen, which also helps build your heart muscles. So you want to do weights and what we call aerobic, both of those. The walking is your aerobic, or dancing, or raking leaves. Any of those is a great exercise. If you have kids and you want to dance around your house for 30 minutes with them, do it. Grandkids, or rake leaves, anything that will get your heart rate up and increase your breathing for 30 consecutively 30 minutes.
Yeah, raking leaves, that's my favorite.
Is that?
Yeah.
Okay.
So I think one important piece that we should talk about is looking at, some people, they try and eat right for the most part. They try and exercise, and they still might have high blood pressure or some other type of cardiovascular related diagnosis, and that is because of it's something hereditary from their genes. So maybe talk to us a little bit about that and how people maybe should pay extra attention if they do know that there have been heart issues in their family history.
Sure. So hereditary are one of what we call risk factors that we cannot change.
Yeah.
So whether you're male or female, in my instance, and I'll use myself, both my parents have heart disease. Both my grandparents had heart disease. So it doesn't mean my risk factors have quadrupled. It means they have probably 10 times worse. So I have to be very careful. We can't change our race. We can't change our sex. All of those are things we cannot change, and family dynamics. So that's why we have to change the risk factors we can change.
Okay.
Exercise, diet, don't be a couch potato, get up and move. Those are things that we have to work on because we cannot change our hereditary risk factors.
Gotcha. So they should be definitely on the lookout. And I've talked to some people who maybe really don't know. So you would encourage people to try and find out what their family history is, correct?
Absolutely.
Yeah.
And sometimes I've heard patients tell me that their family have had spells. And then spells.
Okay.
And then their loved ones just passed away. So it makes me wonder if there were some warning signs that maybe they had some cardiac disease that we just did not know about at the time. So always you can get screening from your physician, or you can come here to Wake Forest Baptist Health and be screened and to see what kind of risk factors you have, as well as what can we do to help you modify your lifestyle.
Okay. So one of the other things that I want to talk about, so we're talking to people out there in the internet land about trying to keep your heart healthy and trying to not have a heart issue in the first place. But sometimes a heart episode does occur. And oftentimes maybe we're more familiar with what it looks like on TV, how it's being portrayed in a TV show of a heart attack, and the kind of the drama that goes along with that. So if you could talk about what actually is a heart attack, what is happening to your body when that is happening, and what should we do if we are with someone who maybe starts to have some sort of heart episode?
Okay. So a heart attack is really where a lot of times your heart is not getting the blood that it needs, and so the muscle is screaming for help and basically dying, a part of it, not the whole heart. And so that's where the chest pain or chest pressure comes in. Everybody experiences it a little different. Chest pressure radiating to your left arm are what we call our classic signs and symptoms. But we don't always experience that. Sometimes it is a feeling of indigestion. Sometimes it is just a feeling of not feeling well. And women experience different than men. Men will have your classic chest pressure, but women will be sometimes just experience more tiredness. And we're always tired. We always tell you we're tired. But it is extreme fatigue or a feeling of what we call impending doom, which means we've all had that. We've all experienced that feeling of, I feel like something's going to happen. I have a bad feeling. That's a feeling of impending doom. And or we just feel, we can feel the chest pressure. And do we just feel like something's not right?
Yeah. So I think one way we can hopefully kind of head that off at the past before it happens is knowing our numbers.
Yes.
So what does it mean we should know our numbers? Talk to us a little bit about that and why we should actually pay attention to some of what the doctor tells us at our checkups.
Sure. So blood pressure should be 130/80. That is something new within the last couple of years.
Okay.
Anything over 130 or over 80 is starting to consider as high blood pressure or hypertension. Your 130 number is the number that is when your heart squeezes.
Okay.
The 30 is when your heart's at rest. So if your number on the bottom is really high, that means there's a problem because your heart's resting then.
You mean the 80 number?
The 80 number,
okay.
Yes. It means that your heart is resting. So if it goes up to 90 or 100, that's worrisome. Okay. Your total cholesterol should be less than 200. And your cholesterol is broken into two parts, LDL and HDL. And LDL is your bad cholesterol. So L for low, we want it low, less than 100. And your HDL is your good cholesterol. So we want it high, H for high, and we want it above 60. So your cholesterol is what builds up these fatty or plaque deposits in your blood vessels. And that's what can cause a heart attack because you close off a blood vessel. So that's why it's important to know your numbers and take care of yourself. So you can know your numbers and modify things to change your numbers.
That's the key.
Exactly.
Once you know them, if you need to make a change, to take it seriously enough to make a change. And I think, some of us might think, oh, well, that's okay. It's a little high, but I'm busy right now. I'll worry about that later. Life gets in the way, so we say. But you can really, if you take care of yourself on the front end, really help add to the quality of your life, correct?
That is correct. And we say you are never too young to take care of yourself. So children, we need to watch our children.
Yeah.
We need to make sure they go outside and play. We need to make sure they eat healthy. We need to make sure they understand what a good diet is.
That's so important.
And if you watch yourself now, that means as you age, your risk factors are a lot lower.
Mm-hmm.
And you have a better quality of life. So, watching what children eat, childhood obesity is really running rampant.
Mm-hmm.
And if we can watch what they eat. And for example, I can remember a patient who, it was a young man in his 40s who had a very serious heart attack and had to have open heart surgery, and said, but I've eaten well the last 5 years. But what did you eat before that? What damage did you do to your heart prior to this time? And you can't repair that damage. You can modify and strengthen the other parts of your heart that's not damaged, but you can't repair your damage.
Well, that's a good segue. I'm glad you brought that up. So if we, let's say maybe some of us don't go to a primary care doctor as much as we should, or get our annual checkup because we're busy, but we recommend everyone do that.
Absolutely.
So let's say you finally end up in the doctor's office and they check some numbers, your cholesterol or your blood pressure, and it's like, whoa, I had no idea it was this high. You shouldn't just write yourself off like, oh, well, there's nothing I can do now, right?
Right.
There are steps you can take to start reversing those behaviors and start improving the health of your heart muscle, correct?
Correct, there are. So diet and exercise, like we mentioned, those are the 1 and 2, diet and exercise. And you may be put on medication with your physician.
Sure.
And all this needs to be guided through your physician. But if you have been guided to lose weight, then go through your physician, because people have been known to be able to come off medication once they lost weight. Now, I'm not telling you to take yourself off. You need to go and partner with your physician.
Absolutely.
To decide what is best for you. Because, again, everybody is different. There is not one plan fits all.
Sure. That makes sense.
Mm-hmm.
Well, along those lines, if you mentioned someone younger was a patient not too long ago, I guess as you go through high school and college and you're a young adult, it's probably not on the top of your mind as much as it should be.
Not
so
really.
Is there a golden number and a golden age when you're like, oh, I hit 40, I should start worrying about my heart now?
So obviously, as we age, we should always start worrying. And I don't know of any golden number to say, okay, from here on out, I'm going to watch my heart.
Right.
As we're younger, we also are invincible. Yeah. And so we don't think about things like that. But always keeping it in the back of our mind, in our children's mind or grandchildren's mind, about eating healthy. And taking care of ourselves. And then family history, really going over your family history with your children or grandchildren and understanding it is one of the greatest educations you can do for everyone.
That's very good advice. So Sandy, we're going to wrap up in a minute here, but before we do, I do want to let people know that they can go to our website, wakehealth.edu, and they can find a lot of great information and resources from your department, from cardiology and cardiovascular. Yeah. There's a health risk assessment on there specifically for the heart that you can look at. And if you don't have a primary care physician, don't listen to me. Sandy's the medical expert here. She says you should get a primary care and stay in touch with them.
Yes.
To know those numbers.
Know your numbers.
You don't want those sneaking up on you.
No, you don't. And that's where our heart attacks come in from, these high cholesterol and high blood pressure. Okay. So take care of yourself.
So we're going to wrap up. Sandy, I want to ask you one more question. After all these years, why do you still do what you do? Why do you come in every day and and help people out here at the medical center?
So I come in every day because for me to watch a patient who has had a serious heart condition, maybe one of our heart transplant patients, or maybe a serious heart attack, come back to our floor and say thank you and tell us how they've changed. It fills my cup, so to say, and it fills all of ours, all the nurses on the floor. Love to see you come back and see your success story. That's why we're in it. That's why we do what we do, to be able to see the successes that we have and be there to help you gain and give you the resources you need to be successful.
Well, that's awesome. Well, thank you.
Thank you so much
for doing what you do every day. And please pass along our thanks to all the nurses that you work with, and of course our expert providers that we have here at Wake Forest Baptist Health. We're blessed to have a great faculty and great nursing team here at Wake Forest Baptist Health. So we appreciate all you do.
Thank you.
Like we said, if you have any questions or if you want to find out more information, you can call 716-WAKE or visit wakehealth.edu, and we'll be glad to answer your questions. So
thank you.
Have a great day, Sandy.
You too.
All right. Thanks, everyone, for watching.
Bye.